that's okay to let people talk as an introduction. Maybe someone wants to say hi before we officially get started. Hey, Jürgen, very nice to see that you're here. It's really nice. I think we're getting waves from people that we know around. That's really nice. Okay, so let's see if we should get started. I think we should, just so that everyone know that we're recording this session. So, and that's for people to be able to see this afterwards. So it will be, well, freely open as a webinar to look in hindsight as well. So just so you know that if you're asking questions or is seen, then that will be recorded as well. So let's get started. I am super happy to be able to introduce this particular webinar that will be about diagnostic analgesia and using objective gait analysis for that. And my name is Elin Handlund. I am a vet. I'm a researcher in equine biomechanics, and I'm one of the 2 founders of the Sleip application. But the Sleip application is produced by a lot of very brilliant people in this team. So even though you know, we were 2 people founding it, it's a very big team that develops the product today. And this webinar is held as a collaboration with, I'd say, 2 of our most sort of keen clients, and also we've had a lot of feedback from both the Tierklinik Lüsche and SMDC along the way of producing this product. So we're very, very proud that these 2 clinics do use the product and that we could get so much good feedback. And with us today from these clinics are Mathilde Pluim from the Tierklinik Lüsche. And Mathilde, she is, of course, a vet. She has a PhD. She's also a diplomat of the Sports Medicine and Rehabilitation College, and has been working in the Lüsche clinic for many years, Mathilde. I think you said even as an intern. And yes. Then this is a clinic with an extremely good retention of staff, which is difficult in our business. So Mathilde is still there. And Mathilde, I know you also serve as the FEI official vet for the German driving team. That's so you have a lot of sport horse experience. And from the SMDC clinic, also super proud to say that I know Rosalie already from your vet studies when you did biomechanics research, already as a vet student. Now you work as an orthopaedic veterinarian at the SMDC clinic, and I know you still, in your very small amount of spare time, do some biomechanics research on objective gait analysis as well. You are also a very successful dressage rider. So when we spent some time in Wellington in Florida, I know you have been there on these arenas competing with your horses. So with that said, everyone is listening. Thank you for tuning in. We said we would have a longer Q&A at the end, so we will see some cases that the vets will be presenting. But I'm thinking that if you do have specific cases, questions regarding the cases that are being presented, I would love for you to jump in. So there is a Q&A. I'll try to keep track of that Q&A. And if you have questions, then we'll let Rosalie and Mathilde present their cases, and we can, you know, have a discussion together after each case. And you guys who are listening, please feed the Q&A with questions, and we'll try to pick those up along the way when we're moving forward. So then I'm leaving the floor to the clinical case presentations.
So if everything went well, then I am now sharing my screen. Can everyone see it or no?
This looks good.
Okay, that looks good. Let me just go to the first page.
Sorry, Mathilde, let's see if we lost you now.
Oh.
Lost your screen. I do see you, but I think I lost your screen.
You lost my screen. That's not so good. Second try. Yeah, anyway, I got asked to do this this talk a little while ago. Then it was like, yeah, can you maybe tell something about doing diagnostic anesthesias with the aid of Sleip. And I've been using Sleip, yeah, since the almost beginning, I would say. I hope this looks good again. You guys see my screen?
Very good. Yeah, this is good.
Good. Okay. So yeah, I thought, okay, well, this, yeah, let's do it. That's actually, it was my first response. And then I started to think about, yeah, what am I going to say? You know, am I just going to say, okay, we block horses for lameness examinations. And if you use the app, you can kind of objectively see if a block was positive or not. I thought, okay, this is exactly 20 seconds. So what else should I tell? So I just went a little bit through my app to see what cases I had actually been blocking with the aid of Sleip. And for each case, I thought, okay, what was the reason that I used Sleip with my diagnostic anesthesia? And so a lot of them was basically just for documentation. I think it's good to kind of have the lameness examination documented, and also the exact lameness. For sure, if you go back to the horse and you recheck them, it's kind of good to see, okay, what was the lameness like? What was it like after the block? What's it now like after the treatment? It's, of course, also very good if you share cases with colleagues. So sometimes you might not be able to do the recheck yourself. And it's good if those colleagues have an actual objective kind of, you know, feedback. Sometimes about legal cases or horses that they want to return for sales, it's just good to have the lameness and the lameness examination documented. And also I used it 2 times for pre-operative planning, you know, if you were expecting an issue in a joint, but also sometimes for, let's say, neurectomy, what can we expect if we block this? What can we expect from the surgery? I also did use it pretty often in mild or very mild lamenesses, where I think it's sometimes subjectively pretty difficult to see a 70% change of lameness, which is a positive block. In multiple limb lamenesses, sometimes the clinical picture can be a little bit confusing. Like, you know, what's the main lameness? Is it just a compensatory lameness, or is it an actual multiple limb lameness? So in those cases, I've been using the app to guide me, really. Sometimes owners will really request it. Sometimes you see an asymmetry where you're not sure about if this is an actual lameness or if it is an actual limb lameness. So you might block and kind of, you know, measure and see what it does. And I have used it in one specific case that was suffering from a tendon injury, where I will talk about right now. I hope you guys can see this pointer now. This is Isa. It's a 9-year-old meter 45 jumper. People called me, it was slightly lame during a competition, and they came to our clinic to show the horse to work up for lameness. So, and this is the plot of the initial lameness. I won't show you all the videos because we'll get to that later. So for those not familiar with the app, this is kind of like the summary of whatever you're looking at. And then these are the front limbs, left front, right front. And these are the hind limbs, left hind, right hind. So a perfectly horse is exactly in the middle on the straight line. And this horse looks pretty perfect behind. But then on the straight line, it looks mildly asymmetry. A mild is asymmetry at the impact of the right front. This is not very much. I think in my experience, we will also have sound horses, unproblematic horses that show a pattern like this. This is very mild. But then on the circle, and this is the left circle, and this is the right circle. And what I always kind of do, and actually the app does it for you as well, is I just kind of mirror these. So I mirror the hind, the left circle with the right circle, because a horse has to lean in. So there needs to be some kind of an asymmetry. Otherwise, the horse would be completely straight and it would fly out of the turn. So behind, there's not much asymmetry at all. If we look at the front, if we mirror this asymmetry with this asymmetry, we do see an orange. So this would be like a moderate lameness on the right front. So anyway, the problem is right front. Obviously, we don't only Sleip them, we palpate them, do flexion tests, and there is a very mild swelling at the superficial flexor tendon. There is also some pain at palpation and a positive response on the flexion test. So I didn't actually block this horse. We just started with ultrasound, and then there's a mild, although clear swelling of the superficial flexor tendon on the right front. And this is a horse that I follow up, that I see a couple times a year, that has never showed anything like that. On the transverse view, there is a mild hypoechogenic spot. So this to me is an acute mild superficial flexor tendon tendinitis. So we started treatment. We started high power laser treatment, which I have been looking into very thoroughly in my career, which always seems to work pretty good. But after 2 weeks, we rechecked the horse, and generally after 2 weeks, I just kind of trot them on hard surface, because these horses are sports horses. They have been only hand walked for 2 weeks. So if we then take them on the lunge line, they're going to explode. So we either look at them slightly sedated on the lunge line, or we trot them only on the hard surface, and we for sure do an ultrasonographic recheck. So the lameness is unchanged on the straight line. It's still very slight, but it's still there. The ultrasound did improve, so the swelling has decreased. It's not so painful at palpation anymore. To me, this was a little bit unexpected. I think it's kind of like good to always second guess yourself, I guess. Like normal cases, if the ultrasound improves, if it's a superficial flexor tendon, those are normally not that painful, maybe initially, but after 2 weeks, I would expect this horse to be pretty much sound, or at least almost sound. So I started to think at that point, is there maybe like a second cause of lameness? I didn't block it initially because to me, you know, the source of pain was kind of obviously the superficial flexor tendon, but maybe there's something else going on. However, a complete lameness examination, so blocking bottom to the higher blocks, you would expect to need maybe multiple blocks. You would have to lunge the very fresh horse. That was undesired to me, to the superficial flexor tendon, because that tendon would actually need at least another 4 weeks of just controlled hand walking exercise. So I didn't want to screw up the nicely initiated healing process of the superficial flexor tendon, but I would also want to know, am I not overseeing something else? So this was a case where I thought, oh, what about Sleip? So I will just show you the videos that we did on the straight line. So I didn't trot the horse on circles, and I didn't trot it on the lunge line. We just trotted it on the straight line, and then I measured all the measurements with Sleip. So I'll just show them to you. I guess I won't really give you my own opinion. I think if it's good to always just look at a horse or look at a video and like make up your own opinion. So this is the horse after 2 weeks. It had treatment. The tendon looks pretty good. It's no longer painful at palpation. This is what the straight line looked like. This is what it looked like after the block. And I started with an ab axial. Sometimes I kind of want to rule out stuff. So yeah, maybe matter of time, maybe matter of invasive procedures. When I kind of want to rule out lower foot, I do an ab axial instead of a PD and then an ab axial. So that's what I did in this case. Then I did a low 4-point. So I would struggle in a patient like this, okay, now we're looking at a video, nicely in our house, having a lot of time, no disruptions at like a slow motion video, where sometimes things are a little bit more apparent. But to me, looking at this horse at the straight line, the lameness was not so obvious that I thought, okay, I am going to spot a 70% difference. And that's why I blocked it with the aid of Sleip. We always trot 2 lanes, like 2 directions, kind of back and forth. but because of the time, I think we'll leave it to 1 lane. So this is the result of the block, and this is just a screenshot of my phone. So this is the initial straight line where you see there's like a mild right front impact lameness. After the abaxial, it's the exact same. And then after the low 4 point, it's still the exact same. And after the high 4 point, where we are also including the superficial flexor tendon, the asymmetry really decreased. So this kind of made me a little bit more comfortable. Of course, we did ultrasound of the suspensory and all the soft tissues in that area. We made some radiographs of that area, which were all normal. So we just extended the therapy with another week. We also did inject some stem cells. And yeah, the horse is now actually doing really well. I examined it last week. It did a ranking class again last week, and it's sound and going. So I guess I can't hear you guys in case there are questions popping up, or if I should just exceed with the second case.
I think, yeah, Mathilde, I will let you know if there are more Q&As that come in. So please, you guys who are listening, you can write your questions in the chat. I will pick them up and then we can take them, Mathilde, together. Like I will ask you specifically what people are writing.
Sounds good.
So if we don't see something dropping in now, then we will then continue with next case. Thanks.
Good, yeah, because I have one other case, which also I thought, okay, here Sleip was really kind of like a game changer to me. So this horse is called Cadeau, and it's an 8-year-old children's dressage horse. The complaint is that it's not performing. It's basically unrideable since a little while. And very often you're not, the veterinarian is not the first one that's called in, like it was in this case. They first changed the diet, they changed the saddle, they changed the rider. Horse was still pretty unrideable. Then they did call in a veterinarian, kind of more, you know, like the things that were not so much orthopedic, but they started like an omeprazole course. They did some physiotherapy of the back. Yeah, no difference. And the people just really wanted to know what's going on with our horse. It used to be a kind horse for our daughter, and now it's not. It's actually dangerous. So I said, do you maybe have a video of the complaint? Because in many cases, that kind of really helps you to have a picture of what is going on. So I don't know if you guys are familiar with the ridden horse pain ethogram from Sue Dyson. I think this is a really, can be very useful. It kind of describes 24 characters that are shown by horses under saddle that may be suffering from pain. A lot of them are kind of behaviors that are maybe being called naughty behaviors or whatever. But it was kind of interesting because I was looking at this horse at the video, and we could almost mark the facial markers with the ears back, the wide of the eye, the mouth opening. It was tossing its head up in the air. It was always above the vertical. It was swishing its head from side to side. It was swishing its tail. And then it was kind of rushing and then slowing down again. It was toe dragging pretty badly. It would turn around, spook. It was resistant. It was at some point also rearing. It would kind of like stop and then run again, and it was bucking. So yeah, this was not a very pleasant horse to ride. Let's call it like that. So I started to look at the horse. First, of course, palpating it, feeling everything. And I'm not sure if these videos are smooth enough with my internet connection. I've learned to never look at two videos at once. So I will suggest you guys also to maybe first look at the left video on the left circle, maybe for like a circle, and then look at the right video for the right circle. To me, I'm not super happy with the way the horse is going. I see sometimes a little bit, maybe mainly on the left side, I would say, like maybe left front, maybe left hind, not super obvious. And this is the analysis that came out. So again, I will quickly run you guys through it. So this is the left circle. These are the hind limbs. Right circle, hind limbs. and front limbs, right circle, front limbs, left circle. So if we mirror these, there's not much coming out of this analysis, not much more than many sound horses will show, I would say, which kind of correlated maybe with my clinical view that it's maybe not perfect, but it's also not really lame. So we drew also a straight line. And I actually have the analysis right here, right beside it. So on the hind, maybe if the asymmetry points towards one side, it's maybe a bit left hind, left front. I'll have him turn towards us so that we can visualize the front end a little bit better. So yeah, on this video, I do see a little bit, maybe the left front for sure. If you put the analysis beside it and it tells you left front, you start seeing the left front, even though you didn't see it before. But anyway, yeah, that was a little bit the clinical issue, a little bit left front, maybe a little bit left hind, maybe. So what's the summary of this case? And of course, I looked at the horse other than just these Sleip videos. So the horse is obviously painful while ridden. It had poor back muscle development. It was slightly skinny, was not a conclusive lameness. I did do flexion tests and the front flexion tests were all negative. And the flexion test on the left hind was clearly positive, and it was slightly positive on the right hind. So at that point, you're a little bit maybe with your hands in your hair, like thinking, what is this issue? Is it just an upper line issue? Is it maybe a horse that's suffering from stomach ulcers? Is it learned behavior, the behaviors that he's showing? Is this actually even possible to block? Is it even really a limb lameness or not? And then the main question, where should I start blocking? So now I will kind of make a little bit of a side jump away from this patient, but to something more theoretically. So this is called the law of sites, and I thought, how am I going to explain this in this webinar? So I did what I always do, Google law of sites, equine gaits, and the Sleip website popped up. So I really advise you guys, if you're not familiar with it, to maybe have a look at it. So it basically says this: if you have front limb lameness, let's say the left front, the compensatory components might be left hind, more even so right hind. But if you have a hind limb lameness, so let's say a left hind lameness, the compensatory component is always on the same side. It's always on the left front. So having that in mind, let's say we have a horse with the left hind lameness, and I looked through my app again, and then I found one. So this horse is a little bit lame on the left hind. You see the mild asymmetry on the straight line only. I included those only. This is a mild left hind lameness to me. And then I blocked it, and the mild lameness is completely gone. It's completely symmetric. So I'll just zoom in a little bit on the results. So where we first have an asymmetry on the left hind, this asymmetry is completely gone after the left hind block, which I put here. So this is easy. This block was positive, no doubt. And the issue was on the left hind. So it doesn't always look like this, because sometimes a left hind lameness might show almost a bit more like a front lameness. And I think this is the case both clinically, but almost more so maybe with objective gait analysis. And this is another example that was a little bit, it's always towards the right. So it's a bit right hind, bit more right front. I blocked the right hind, and the asymmetry on the right hind decreased a little bit. If we zoom in, we see it a little bit better, but also the asymmetry. So this is probably the compensatory part on the right front, decreased. So to me, this was also a positive block on the right hind and a right hind issue. So I started blocking the left hind, and that was probably for two reasons. First of all, because I know these sites, that is sometimes a bit confusing. So the law of size that will point maybe to a front, even if it's a limb, if it's a hind limb. I wasn't quite sure, to be honest. I could have also maybe started at the front, but I tend to start with the hind if this pattern is shown a little bit like that. But most importantly, on the clinical examination, there was an obvious response to the left hind flexion test. And that is sometimes I think that we should never stop including. We should always do or complete clinical examination, and we should always look at the patient. So again, I won't say too much. This is after a low 4-point. Remember the video that I showed you initially that, yeah, I wasn't quite sure, maybe a bit left hind, maybe a bit left front. Nothing too obvious. So we'll have a trot towards us. I think it's also just a little thing on the side. It's important to always trot them on the same location, ideally with the same handler. And this is my assistant that also always has the nice correct pace, because that can actually have an influence. So here we see the lateral plantar nerve that I blocked on the left hind. To me, these videos all look pretty similar, to be honest. When I was selecting them for the talk, I had to look at the time that they were taking when I was putting into my presentation, because I think it's kind of hard to tell, you know, when the asymmetries are so little, it's kind of hard to tell, is this different compared to the last video or is it not? It's of course a lot easier in horses that are that show a much more obvious lameness, but of course, yeah, you know, then you don't necessarily need the Sleip app, where in this case, I did need it. So this is the outcome of the blocking. So this is the initial asymmetry. So in the hind, we don't see that much, a little bit left front. This is after the low 4-point, still a little bit left front. And then if we compare these with the lateral plantar nerve, we see that this kind of so-called left front asymmetry changes sides to the right front, even though the left hind limb is blocked. So to me, this was a positive block. And this was a reason to take radiographs and to do an ultrasound of the suspensory ligament. And this horse ended up having bilateral proximal suspensory desmitis, where it was treated for. And the treatment succeeded, and the horse is now being a sweet children's horse again. So people are happy. The patient is doing fine again. The horse is no longer so-called naughty. And I think in this case, is it helpful to use Sleip at the diagnostic anesthesia? Well, in the two cases that I just presented, definitely yes. So that's a good yes to me. Is it always a decision maker? Sometimes, I think not always. Like I say, you don't, and I know Sleip is working on the analysis during flexion tests, but flexion tests are and also palpation, like that is not something that I did include in the app. I think the flexion tests are soon gonna be able to be measured with the Sleip app, but these are things like palpation, manipulating the limb, flexion tests, like these are all things that you also take into account when you make a decision. Is it completely dummy proof? No, because I think sometimes you can get a little bit confused, and you should have some knowledge about the law of sides, because you know, like I was showing in this patient where it's very mild, then sometimes the front asymmetry comes out as kind of like a stronger component as the hind asymmetry, even though that is not the primary limb lameness. And I am very excited, as I said, about Sleip's future development. For example, I know that they're working on having an objective score of flexion tests and so on. So I think that was it for now. I'll just stop sharing and
Thank you so much, Mathilde. I think you pulled up two really good cases for us here, and we'll see if the Q&A is getting bombarded with some questions for us. So I'll just pick from the top here and we can discuss together a little bit if we have more time. But it says, Erin Tallman comments that Sleip only analyzes the limbs or lameness. Could this case be more than lameness? And I'm guessing, Erin, that is probably on case number 2, the pony. That's what we don't want to call a naughty pony, because that's probably a very honest pony.
So if there could be more going on than just a lameness.
Mm-hmm.
Yeah, I think so. And obviously, I think that's why I put it a little bit at the anamnesis, because I think a lot of these horses are, they first change everything. So they do a different saddle, they take different lessons, they put a different rider on it, they change the diet. These people did everything, and they'd known the horse, and it used to be a kind horse, and now it's a naughty horse. And I think we also see those cases, and sometimes it's not actually pain. I guess you can tell. And I think this is also one of the reasons why I wanted to block this horse, to see if it was actually painful, because it was also not that lame. And I think Sue Dyson's chart, like some of the, like the rearing and the bucking, yeah, okay, any horse, this is kind of apparent behavior, but some of the signs are much more subtle. And I do think that it is good for us veterinarians, but also for owners and riders to look for those, because this horse, I just kind of learned this skill for my exams, basically. So, you actively search for them, and then you think, okay, this horse is hitting almost every marker. That's probably not just naughty. I guess we should always kind of rule out pain before we start calling horses naughty.
Yeah, and I think that's specifically the vet's job. I think it's important for us vets to acknowledge that part of that will be probably communication. And Dilip Kumar Das asks about this article of Sue Dyson. It's easy to look it up. I think it's called the Equine, like ridden horse pain scale or something like that. There are several articles, and I really encourage people in this audience to keep an eye out for a very nice publication, or actually a thesis that one of our PhD students in Uppsala is presenting in June. Johan Lundblad, who will be presenting his very, very in-depth work on equine pain. And just to let you know that we call this a little bit the equine ridden pain ethogram or something like that. It's not only pain that these horses are showing, it is aversive behavior to the riding that they're being subjected to. So it's to be very scientific, and that's my role here, I think, to be the geek. It is not per se proven to be pain behaviors, but there's a lot of very interesting research going on in terms of acknowledging what type of spectra of actually facial muscles that are being contracted in a horse that has stress versus pain versus other types of emotions, or we don't know very much about their emotional life, to be honest. So, but it's a very, very important point you're making, Mathilde, that the behavioral part is extremely important, and that our jobs as vets are to try to rule out if there is a pain component, which you nicely did with a very complicated gait analysis, because I think in general, you very neatly picked up that this could be a compensatory pattern. And that's important to acknowledge in these cases, that sometimes you can actually block a limb that is not the most colored limb in Sleip, and that's completely correct, even according to the book. So thanks for highlighting that and showing that these cases can be very complicated, because that's absolutely true. That's good. Okay, so Nigel asked how old the second horse was.
8
years old. And we will send, I think, to you the title of these articles, Deb, so we can, there's a lot of different research. I would suggest you look at also the articles by Katrina Ask and Johan Lundblad and Sue Dyson. So there are several groups working with there's also a Swiss group working with equine pain behavior, and a Dutch group. So there's a lot of research going on in terms of equine facial pain.
Yeah, and the reference of the description of the actual ethogram is on the slide. So if you would look it up, look back at this webinar, you'd be able to find it.
That's really good. And one last thing I would like to ask you, Mathilde, before we move over, it's time for us to move over to Rosalie, but I think you said neatly that you asked yourself a question with the first case, because that was a bit more clear in terms of asymmetry, a bit less complicated in terms of the compensatory pattern or the pattern that it showed on the objective asymmetry. But you asked yourself, like, could I for sure make a judgment of if this will be 70% positive or 50% positive or something like that.
Right.
Can you elaborate a little bit on how you, as a clinician, would like decide when do I use objective gait analysis or not? When is it useful?
So I think, to me, if the lameness is very mild, so we've graded maybe as like a 1 out of 5. So it's like maybe not every step, or it's every step, but it's very subtle. And then, like I said, we're now making ourselves it's a little bit easy because we have the zoomed in slow motion videos where it's actually easier to see than if you just look at the video of this horse, but also then when you look at this horse live. And we know that if we do nerve blocks, that you do not always necessarily expect 100% improvement. Like, this is not regarding Sleip, but just in general. So if it's like a very subtle lameness, I think it's sometimes, I've heard myself saying very often, it's too little to block. It's too mild to even block, you know, like this is something that I'll be saying very often. And then I guess in the case that I showed, the lameness was a little bit more obvious on the lunge line. So in a case like that, I would block, and I would always go to kind of like the situation where it shows the lameness the strongest. But in this case, I didn't want to, you know, lunge that horse for so many minutes on the soft surface in kind of a little less controllable environment on the soft footing with the superficial flexor tendon that was actually starting to heal. So yeah, I think it's always good if you start blocking to always compare the horse in its worst situation. So that might be a left circle, right circle, hard surface, soft surface, whatever. But even then, like sometimes the lameness is even in its worst situation, it's very mild. And we know that we are biased, so that we know that you know, when we see, oh, the coffin joint is a little bit full, it's probably a foot. We know that even if the pattern is the exact same, your mind is a strong organ, I guess. So it starts to look at the horse in a more positive way, and you think the block is positive. And I think, you know, yeah, we should, I mean, we are always researching the cause of lameness in a horse. I think we should see ourselves like that. So it's good to try to be as objective as possible. And I think Sleip helps very, very much with that.
That's cool. And I think you had a very consistent pattern to show in that horse. So if you have a very consistent pattern, but even though it might be small, it will still be a little bit easier to judge it. It's more difficult when you have more variable data. There are 2 more questions, Mathilde, in the chat. I don't know if you can see the chat, because I would love for you to answer those, or I can answer them written as far as I can. And then we will move over to Rosalie, so we don't steal too much of the time of the next case.
Okay. So
Rosalie,
I can't hear you, Ellen.
Oh, sorry. I was asking you to unmute, and I had apparently muted myself. So that's good. Rosalie, go ahead and present your case, and we'll see if we can.
Let me share my screen. Wait a sec. Do you see my PowerPoint and my pointer?
That's perfect. We do.
That's perfect. Then let's get started. Thank you for the introduction, Ellen, and thank you for the invitation. My name is Rosalie Bos. I work at SMDC, the Sporthorse Medical Diagnostic Centre based in the Netherlands. And we're a specialized equine orthopaedic center. Does it continue? Yeah. So just as a short introduction, we work with 11 veterinarians, but also with physiotherapists, dentists, and farriers to provide, of course, best patient care in a multidisciplinary approach. Regarding objective gait analysis, we have 3 systems at the moment. Of course, we use Sleip, actually from the beginning on. We also have Q-Horse and Echinosis. And we use Sleip in our daily practice actually on all cases. So we video and analyze every horse, because Sleip is of course an easygoing system and easy to use. So we video all horses, which is good for documentation and nice for follow-up, especially over time. The other two systems, so the Q horse and the echinosis, I must say that we use those on, for example, more complicated cases, or also for study purposes, so for data collection. So I must say that we use gait analysis as a tool, and we do our own visual assessment and clinical assessment, and then we compare that with the objective assessment. And I think it's especially useful when we consider to start blocking and in cases of multi-limb lameness. Because when we talk about blocking, I think you can all agree that sometimes it can be very challenging to assess your effect of the block. For example, it can be difficult to evaluate the amount of change, especially for a low degree or subtle lamenesses. And of course, we're also dealing with the expectation bias. So speaking about that, I brought this case today to discuss with you. It's a 12-year-old KWPN gelding used for pleasure riding, was bred by the owner and didn't have any complaints so far. But last year it had this intermittent right hind limb lameness. They rested the horse, they gave not enough improvement. Their own vet did several treatments of the right hind stifle and the neck, and they adjusted the shoeing, but there was all not enough improvement. So the horse was referred to SMDC for in-depth orthopedic examination, and the owners and the referring vet had a special request for objective gait analysis. So we start with the first straight line trot, and I hope that the video runs well. What you can see on this horse is that it's also wearing the echinosis sensors, so one on the pelvis, one on the head, and one on the right front. And of course, here at the clinic, we have the luxury that we work in a clinic like this, but we try to do our clinical examination in a standardized way. So for example, we always start with the straight line trot hard surface, then soft circles, we continue to the circles and so on. I think that's a very good way in have reliable clinical examination for every patient, but also for reliable data collection when we're talking about gait analysis. So I hope that you can see this video properly, and I think you can all agree with me that we don't see a very clear or obvious lameness popping in on this horse. If we then look at the Sleip output, on the right side you see these clock plots, so for the front limbs and for the hind limbs, which actually gives you a nice and quick overview of the side of asymmetry that we're dealing with and the type of asymmetry that we're dealing with. And then in this table and this sinus curve, you get a more detailed information of your data, so also the amount of asymmetry and the standard deviation, so the variation between strides. If we look at this horse, we see that it has a right front push-off lameness and a right hind push-off lameness, although very mild, but you can also see that here in the table. If we then continue to the circles, I have here a video of the horse trotting on the gravel circle. We use this gravel circle as a hard circle, but without the risk of sliding and falling. And you see that the horses are very comfortable trotting on this gravel circle, which gives us a nice way in examining the horse on a hard surface versus a soft surface. And meanwhile, I'll let the videos run. Of course, the thing with circles is that because the horse is trotting on a circle, also what Mathilde already point out, is that we have a circle-induced asymmetry. And I think one of the greater values of gait analysis is that in that way you can objectively compare between the left circle and the right circle, and that you can have a look at the patterns that the horse is showing. Like, do we have a normal or to be expected circle-induced asymmetry or not? And could it be indicative of lameness going on? Meanwhile, let it trot on the right circle. So just have your own opinion about the videos, but to me personally, in general, I didn't see any great significant asymmetry or lameness. Maybe on the right circle, a little bit right front, but I mean, especially for the hind, it was quite difficult to see. Okay, so let's continue to the output of Sleip. So here we have the table for the left circle and the right circle, and here the clock plots for the left circle and the right circle. And of course, that's a lot of data, but I think the most important here to look at, for example, on the left circle over here, if we look at the hind limbs, we see that there is a left hind impact asymmetry and a right hind push-off asymmetry, but which is actually a normal circle-induced pattern for a horse trotting on the left circle. So that doesn't bother me at all. If we look at the right circle, however, we see that there's an impact asymmetry on the right hind, which is to be expected. But there's also a push-off asymmetry on the right hind, which is unexpected because we would expect that to be on the left hind. So this could be indicative of a right hind, although subtle lameness going on. And then there's also this right front, mild right front push-off asymmetry of both circles, or on both circles. So here after lunging, we do a new straight line trot. I must say we do that, try to do that every time, especially before we start blocking. So after lunging, a new straight line trot to see if we have a consistent lameness. Sometimes the lameness changes after warming up. It either warms out or it becomes more consistent. So I hope the video runs well, and maybe here you can start to see a very, very, very mild right hind, right front lameness, but I must admit it's still very, very difficult to see. If we then look at data of Sleip again, we can see indeed that we still have this right front push-off lameness and this right hind push-off lameness with a little bit more, which is a little bit more apparent and more consistent. So then we decided to start blocking. And if we take, so then we take the law of sides into account, like Mathilde already explained. We have this right front and right hind asymmetry. So according to the law of sides, and of course that we did the flexion test and the horse had a mildly positive flexion test of the right hind, we decided that we continue blocking the right hind. So then we start blocking the right hind. We start with a low 4 point. And of course, this is the point where it gets tricky when you start blocking a very subtle lameness. Is the horse, has the horse improved? Yes or no? And I think Mathilde already mentioned it as well, is that when you start blocking, try to standardize your measurements before and after blocking. Use the same straight line, same speed, so preferably the same runner. Make sure that you have a steady horse. You can see that this horse is nice and steady trotting up and down. But if you have a youngster or a very fresh horse that goes all the way, that makes it more difficult. So in that case, it's maybe just sedate them a little bit to get more reliable data and that you have as little variability as possible. So, and meanwhile, you saw this video, but for me, it was still difficult to see or have an opinion about it. Is the horse better, yes or no? So then if we look at the output again, we have here the straight line before block, so our baseline straight line, and here the straight line after block. And what first catches your eye are these clock plots. And if you have a look at that, you're like, oh, there might be some change going on. But if you then look at the percentage of improvement, that's only a 26% improvement of this right hind push-off asymmetry. So I was not convinced by this data that we have a positive block. And also when I compared this straight line with the first straight line that we did, so before the lunging, it had quite the same appearance. So then I also started thinking, what is the effect of bringing the horse in, putting the block, let it wait for 10 minutes, and then let it trot again? Did that have any effect on our blocking? So altogether, I was not convinced that we had a positive block here. We also did the circles, of course. I did not include the videos and measurements time-wise, but there was no significant difference on the circles either. So we continue blocking and we did a tibial nerve block of the right hind. So just have a look and form your own opinion about this one. I must say it's all very minor and subtle to see with the with your eye. And we have it trot away from us once more. Okay, so let's move on to the data that we have now. And now there is something starting to change significantly. If we look at the straight line measurements again, so before the blocking and after the blocking, while we first had this although very mild right hind push-off asymmetry, we have more of a left hind impact asymmetry now. And you can also see that here in the table. So we have an 88% improvement of the right hind. So we actually eliminated the right hind push-off lameness, and there is an increase in the left hind impact lameness. So we consider this as a positive block so far. I also have the circles again here. I'll let the right circle run at the same time, because it's still very difficult to see, still a little bit variable in the right front, and the light have for the hind limbs is very difficult to say, at least for me. If we then look at the data of the circles, again, a lot of data, but I'll just point out the most important things here. If we look at the left circle, so before the blocking and after the blocking, we see that there is an improvement or diminishing of the right hind push-off lameness that was over here. But most important is when we look on the right circle, is that where at first we had this unexpected right hind push-off asymmetry, that one switched to a left hind push-off asymmetry. So that is a significant change, and altogether we consider this as a positive block. Then I'll give you something about the diagnosis, because of course, as veterinarians, we like diagnostic imaging and also a diagnosis. So we checked the suspensories of both hinds, which were absolutely fine. And then we also imaged both hocks. And then the diagnosis was that they had osteoarthritis of the distal intertarsal joints, both hinds, but right hind more obvious than the left hind. So I included 2 radiographs of the right hind, where you can see it clearly here. And the left hind had the same problem, but in a far lesser extent. So the horse was treated, and here I have a nice comparison of the recheck after 6 weeks. Owner was very happy, the horse was doing well, right hind was much better. And we also see that in our lameness or in our measurements of Sleip. We see here a 70% improvement of the right hind push-off lameness. So everybody was very happy with that. If you look closely, the horse still has this right front push-off lameness, which you can see here and over here. I must say that these front limb push-off lamenesses are very tricky, and at the moment we don't know enough about them. My personal experience is that they are very difficult to block. So actually currently I'm working on a study on these front limb push-off lamenesses and gathering data. So hopefully in the future we get rid of all these push-off lameness frustrations. But yeah, we're working on that. So of course we can dive in all the data more deeply, and I think we can talk about that for hours. But I think that the conclusion and the value of the gait analysis in this case is way more important to discuss, and that is that we actually detected a subclinical problem in this horse, thanks to the gait analysis. And I think take-home message is that even a very subtle asymmetry can be clinically relevant, and especially for bilateral lamenesses. Then the big questions is, do we have to worry about any asymmetry that our horses are showing? No, I don't think so, because also when you look at studies that our sports horse population, more than 70% show an asymmetry. But I think in this specific case, we have a specific complaint of the owner, we have a specific request of the owner, and of course you take into account the whole history and your full clinical examination. So they all that taken together, and although the asymmetry was very mild in this case, it was consistent, and it made us deal in this case the way we did, and we ended up with a clear diagnosis. Horse is treated, the horse improved, the owner was happy, which is also very important. So in the end, I think in this case it really helped us with this diagnostic puzzle. But I don't think you can expect black and white answers from gait analysis, of course. But I think it is a very valuable tool in our orthopedic examinations, at least. So that was actually what I wanted to discuss with you. I think we have time for some more discussion and questions. I would already pop up some discussion questions. I think I discussed most of it maybe already, but I was just wondering, does anyone have any other opinions or experiences or any other questions? I think that would may be nice to discuss.
That's wonderful, Rosalie. Thank you so much for this presentation, and thank you, Mathilde, as well. I think we will dig in. We have a few minutes now that we can spend on discussions, but I think we promised to be done at 7, so we'll try to keep that. First of all, super important topic that you're touching upon here, and every small asymmetry is clinically important. I think there's only a clinical examination, a very full clinical examination, or maybe several ones that can tell you if it is a clinical problem. So gait analysis will never tell you if it's a clinical problem or not, though it can give you a very big exclamation mark around a specific, limb that moves in a specific way, or give you, circle in something that could be suspected. So adding that information, I think both of you do put that together, but that's coming from Sleip and talking from the voice of Sleip, that's something that we really need to make sure that people understand, that gait analysis, you cannot use it without the full clinical examination, but it gives you additional information, a bit like augmented eyes is my feeling a lot of the time when I use it. We do have a question from Nigel who asks if you block the TMT in this one. I know
we did not block the TMT itself. We treated it
by being just above the hook. I can understand that. And I wanted to ask you, because I want your clinical opinion here, and Mathilde, please jump in as well. You said I was not happy with the percentage improvement. Let's take 1 minute to talk about that subject, because you had a 26% improvement or something first, and then you had about 70%. It was a very small asymmetry that you had. And the pattern, as you said, was very difficult, but also very repeatable. And I think that was important. So what would you expect? What would be your limit of acceptable improvement if you look at objective gait analysis data?
If you really look just at the data, for me personally, I would need at least 50%. But of course, it's also the rest of your clinical examination, because Sleip only gives you the asymmetry. And also you look at, is the horse more comfortable? How is the protraction? How is he behaving in general, and all this kind of stuff? I think it's important to mention that those things aren't measured with Sleip and only with our eyes. So it's always important to get that together. But I think for those very subtle asymmetries, especially in this case, it can be very tricky. And are you deciding, am I continuing to block? Am I continuing blocking? Yes or no. But I think you have to take all those things into account. And if you are in doubt, just continue.
Yeah, and Mathilde, can I ask you then, who also uses objective gait analysis for a long time and have a lot of orthopedic patients as well?
Yeah.
So I think for those last percentages, so let's say you blocked 50%, is there a danger that we send out our colleagues on a hunt for the last percentage of asymmetry, and that will just take them into a pit?
Maybe I could just share my screen, because I was going to talk about the lameness on the hind limbs, and sometimes it's very obvious and the asymmetry completely disappears, and sometimes it kind of decreases, but is it enough or not? But then I also, I just have one case that I thought, okay, I don't know if you guys can see my screen again right now, probably, hopefully.
That's great.
So I included it in case we had enough time. But so this is a hind limb lameness as well. And I know it's a lot of data, and it's okay, what we're looking at. But so we're looking at a left circle here, and we're looking at a right circle here. So the left situations are the situations before blocking, and then the right situations are the situations after a lot of blocking. I think I started with a low 4-point, then did a high 6-point, and then I started to block the medial femoral tibial joints. And this is a horse that I blocked on the right hind. So it's not actually super consistent, but if we mirror these, so the initial kind of lameness with this one, we do see, yeah, an obvious enough asymmetry towards the right hind. And then if we mirror these, which the app does for you, after the medial femorotibial joint, we do see a difference. And obviously I had been blocking some blocks before. Yeah, like in this case, it was, well, I'm almost at your 50%, Rosalie, because I'm at 46%. But also the ipsilateral component of the front decreased. So to me, this was a positive block as well. Even though it's not always so straightforward. I think it's the same thing on the clinical issue. And now I can say, yes, this block was positive because we ultrasounded the stifle and it looked like some terrible synoviitis going on and a big effusion of the joint. And he treated it, and I looked at the horse again, and it now shows a nicely symmetric pattern, which I could have included. I didn't do it. So now I'm really sure that this was actually enough improvement. So I think we should kind of be aware that sometimes you don't always get the 100%. And for sure, maybe in kind of stifles, I don't like to treat all three compartments and then treat it the same day. If it's like an ambulatory patient, I'm there one day, so I should, do my workup and treatment on the same day. It's a bit different than in the clinic where you could maybe spread it out over multiple days. So, in case you also want to treat that patient, I could maybe have, aimed for different departments on the stifle. We know that most of them are collaborating with each other, so to say. So in this case, after the blocking, it wasn't super straightforward, but this is also sometimes what a blocking pattern can look like. And I think it's mainly in the hind limbs where they're not always so obvious as they can be in the front limbs.
Thank you, Mathilde, for sharing that, because I think it's a very good take home for everyone. And I think, Rosalie, your 50% will more or less hold. It's a good rule of thumb.
Yeah.
For research papers, we sometimes use 70% blocks, but let me tell you, then we've gone through our big clinical databases and we've excluded a lot of cases, because very few cases do actually objectively block to 70%, even though we as clinicians think that they blocked. So just so everyone knows who's listening that you shouldn't always go hunting for those last percentage of asymmetry, because your eyes might think that there's like a visual threshold that we might not get under. And then sometimes we have horses that you guys showed also now that nicely switch to the other limb. So we even do find bilateral lameness. And Antonio Luciani also tells us that, don't you think that mild asymmetries could sometimes be significant and measured in cases of even high degree of bilateral lameness? I completely agree, Antonio. We're looking more into these patterns and try to understand them more. There can be very small but very consistent degrees of asymmetry. And I think, Rosalie, your case was very clear there. It is a bilateral hind limb lameness problem that is very small in terms of amplitude. So the coloring, so to say, of Sleip is not as big as you might expect from a lame horse, but it is very consistent. And I think take that home with you as well. It's the consistency of the pattern that is maybe one of the most relevant things, and, not to overfocus on colors.
Exactly.
And then Nigel asks you, Mathilde, as well, how long it lasts between your high 4-point and the assessment after your stifle blocks. Would you be concerned the improvement seen was due to diffusion of local after your second block? Which is something we often scratch our heads about, I think.
Yes, very much. Yeah, I think with the local nerve blocks, they're only kind of relatively local. So yes, the low 4-point block, I know that it sometimes can kind of give part improvement, even though it's like a proximal suspensory. But so in this case, I blocked a low 4-point, which might have diffused at some point 10 minutes, I just look at the horse and then block them again. I try to always work as fast as I can. Then did a high 6-point. There was still no difference in the movement pattern. So I think if there would have been diffusion at the high 4-point, we would also have had some effect of the high 6-point. We do, however, I think this is also a good clinical notification that blocking the stifle can actually, through kind of like diffusion out of the for sure, like the lateral compartment, but also the medial compartment. It can kind of diffuse and kind of block the foot. There were studies performed recently that I think after 30 minutes, half of the horses with foot pain were blocked. So I think it is good to always look at your blocks, kind of maybe right away after 2 minutes, and then again maybe 5 minutes, and then maybe again 10 minutes. But yeah, I try to kind of look at them a little bit. For sure, no longer than 10 minutes.
No, and I think there's a lot of clinical information in that timing for sure. I know the study you're referring to, Mathilde, I think we should be a little bit cautious about how we interpret that data, but I completely agree. There's always caution in terms of diffusion, but very important still to block. Guys, I will then by this, thank you so much for joining this webinar, Mathilde and Rosalie. It was an honor to have the both of you here. Thank you to the Sporthorse Medical Diagnostic Centre and to the Tierklinik Lüsche for lending your brains to us this evening. And for anyone who has questions, I'll also post in the chat. We have a blog on our website that can help you with both compensatory pattern interpretation, but also circle patterns. So if you felt overwhelmed by what should an asymmetry be on a circle or not, what is a normal and not, there's more information to find on the website. Perfect. So thank you everyone for joining. It was a lot of people listening up. More than 100 people actually were looking at this webinar actively. We're very happy about that. And tune in to the next one. And thank you very much for joining.
Thank you for the opportunity.
Thank you very much.
Bye, everyone.
Bye-bye.